Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I'm Nishaba, a certified medical coder. Today in this video, we will cover the spine and spinal cord and essential section of the nervous system. We will go over through some practice questions to help to solidify your understanding. So without further ado, let's get started. In the CPT, the spine and spinal cord section is a vast topic. Today in this video, we will focus on key guidelines, important codes, and their distribution. Catheter and reservoir or pump implantation codes are based on implantation and removal. For catheter implantation, the course depends on whether the procedure is performed with or without laminectomy. For pump implantation, the codes are determined by whether a subcutaneous reservoir, non-programmable, or programmable pump is used. Laminotomy, also known as hemilaminectomy, may involve partial fascectomy and foraminotomy. CPT code 63040 to 63044 are used for revision or re-exploration in a patient who previously underwent surgery and later developed recurrent symptoms. Laminectomy procedures are performed with or without fascectomy. When performed without fascectomy, codes are based whether the procedure is performed on one or two or more than two vertebral segments. Codes for the anterior or anterolateral approach are used for the removal of a damaged or herniated disc. While eliminating option through this section, remember two key points. To report anterior cervical dissectomy and interbody fusion, never report code 60075 or 60076 in conjunction with code 20554, even if performed by the separate individual. To report this procedure performed at the same level during the same session, use code 20551 or 20552. If the microscopic technique is used to perform the procedure, do not code it separately. Paravertebral spinal nerve injection involve the administration of a diagnostic or therapeutic agent into the facet joint. Remember that the facet joints are paired at each vertebral level. Codes are based on number of facet joints injected, not the number of the nerves. So when coding, count the number of the facet joint injected, not the number of the nerves. Add-on codes are used when injecting a second, third, or additional levels in the same session. When coding for facet joint injection, always remember some key points. All codes from code range 64490 to 64495 are unilateral codes. For bilateral procedure at the same single level, report the primary code with modifier 50. For each additional level, if performed bilaterally, the add-on code should be reported twice. Never use modifier 50 with the add-on codes. Dr. Stephen completed an anterior dissectomy with decompression, including osteophyectomy to level C3 to C5. During the same session, he stabilized C3 to C5 with anterior cervical interbody fusion. For proper visualization, Dr. Stephen used an operating microscope during all phases of the procedure. How should Dr. Stephen report this procedure? Option A with code 63,075, 63,078 along with modifier 51, 22,551, 22,554 into 2, 69,990 along with modifier 51. Option B with code 63,075, 63,078 along with modifier 51, 22,551 into 2, 69,990 along with modifier 51. Option C with code 63,075, 63,076, 22,554 into 2. Option D with code 60,075, 60,076, 22,551, 22,552. In the given scenario, an anterior dissectomy with decompression, including osteophyectomy at level C3 to C5, is performed. CPT code 60,075 is used to report this procedure. Based on the parenthetical note given below the code 60,075, we first eliminate option A and C. The note state do not report code 60,075 in conjunction with code 22,554, even if performed by the separate individuals. In the remaining two options, we can easily eliminate option B due to the use of modifier with the add-on code 60,078 and 69,990. Therefore, the correct option is option D with code 60,075 with add-on code 60,076, which are used to report an anterior dissectomy for two cervical interspaces. CPT code 22,551 with add-on code 22,552 are used for anterior interbody orthodesis for two cervical interspaces below C2. The patient was taken to the procedure room, placed prone, and the L4 to L5 interspace was identified using fluoroscopy for the injection site. The patient was prepped with betadine and covered with steroid drip. After achieving proper anesthesia, a 3-inch 20 gauge toy needle was inserted towards the L4 to L5 interspace. Using the 6 cc glass syringe and the loss of resistance technique, the epidural space was located. After confirming no blood or cerebrospinal fluid upon aspiration, the syringes were changed and 80 mg per ml preservative fee depometrol and 2 cc of 1-methyl paraben fee lidocaine were injected slowly. After the procedure, our needles were removed intact, the skin cleaned, and the bed aid applied. Quote this encounter. Option A with code 62,323, 77,003 along with modifier 26. Option B with code 62,322. Option C with code 62,320. Option D with code 62,323. In this scenario, the L4 to L5 interspace was identified using fluoroscopy to determine the injection site. Since the procedure was performed in the lumbar region, we can easily eliminate option C with code 62,320 used for cervical or thoracic injection. Additionally, because imaging guidance was used during the procedure, we can also eliminate option B with code 62,322, which is used for lumbar or sacral injection performed without imaging guidance. In remaining two options, we can eliminate option A with code 77,003, which is used for the fluoroscopic guidance. This code is already included in the code 62,323 as mentioned in the code description and also noted in the parenthetical description below the code 62,323, making it unnecessary to mention separately. So our correct option is option D with code 62,323. A 60-year-old female with failed back syndrome has undergone a recent test dose of intrathecal necrotics with a good pain response. She has been brought to the operating room for the preparation and insertion of Medtronic programmable pen pump and intrathecal catheter. Select the procedure code for this surgery. Option A with code 62,360, 62,350 along with modifier 51. Option B with code 62,362, 62,324 along with modifier 51. Option C with code 62,361, 62,324 along with modifier 51. Option D with code 62,362, 62,350 along with modifier 51. In this scenario, the procedure involved the preparation and insertion of programmable pump and intrathecal catheter. Since the procedure includes the insertion of programmable pump, we can first eliminate option A with code 62,360, which is used for the insertion of a reservoir under the skin, as well as the option C with code 62,361, used for the insertion of non-programmable pump. In both remaining options, CPT code 62362 is used for the implantation or replacement of a programmable pump. Based on the type of the catheter used in the implantation, we can also eliminate option C with code 62324, which is used for the injection procedure involving the placement of indwelling catheter. Therefore, the correct option is option D with code 62362 and 62350 with modified 51 to indicate the multiple procedures were performed during the same session. Dr. Smith performed surgery on Mr. Johnson, a patient diagnosed with cervical stenosis as revealed by MRI. It was determined that he should undergo a bilateral cervical laminectomy at C3 through C6 with fusion. The edges of the laminectomy were cleaned with kerosene and paravertebral were performed as C4, C5, and C6. The stenosis was central, so fasectomy was performed using a burr. Nerve root canal were freed by additional resection of the facet, and compression of the spinal cord was revealed by removing tissue overgrowth around the foramen, which CPT codes is reported for this procedure. Option A with code 63,045 along with modify 50, 63,048 along with modify 50. Option B with code 60,020 along with modify 50, 60,035 along with modify 50, 60,035 along with modify 50. Option C with code 60,015 along with modify 50. Option D with code 60,045, 63,048 into 2. In this scenario, a bilateral cervical laminectomy at C3 to C6 with fusion was performed. Since laminectomy is the primary procedure, we can easily eliminate option B with code 60020 used for laminotomy procedures. Additionally, because fasectomy was also performed due to central stenosis along with laminectomy, we can also eliminate option C with code 60050, which is used for the laminectomy procedure but without fascectomy. In remaining two options, CPT code 63045 is used for laminectomy, facetectomy, and foramenotomy. Based on the modified 50 used with code 63045, we also eliminate option A as this code already covers both unilateral and bilateral procedure, making the modifier 50 unnecessary. So, the correct option is option D with code 63045 along with add-on code 63048 into 2. Mrs. Ellis slipped on the ice last winter and fractured several lumbar vertebrae. Since then, she has been receiving pain management therapy at her local hospital with an anesthesiologist. The anesthesiologist performed a therapeutic injection of 5% mercury mixed with steroid decadron into the nerve located in the facet joint at the level L3 to L4 and L4 to L5 on both sides at each level. What CPT codes are reported for this procedure? Option A with code 64,493 into 2. Option B with code 64,493 along with modified 50, 64,494 along with modified 50. Option C with code 64,493 along with modified 50, 64,494 into 2. Option D with code 64,483 along with modified 50, 64,484 along with modified 50. In this scenario, a therapeutic injection procedure was performed in the facet joint at level L3 to L4 and L4 to L5. Since the procedure targeted the facet joint, we first eliminate option D with code 64483, which is used for the transfemoral epidural injection procedure. In the remaining three options, code 64493 is used for injections of a diagnostic or therapeutic agent into the paravertebral facet joint, lumbar or sacral single level. We also eliminate option A with code 64493 into 2 as this code only cover one level since the procedure was performed at two levels and the add-on codes are available for each additional level. There is no need to mention two units of the code 64493. We also eliminate option B with modifier 50 used with add-on code 64,494. Although the scenario involves the bilateral procedure at both levels, we indicate the primary level with modifier 50. However, to indicate it for each additional level, instead of using modifier 50 with the add-on code, we must report it with two units. Therefore, the correct option is option C with code 64,493 along with modifier 50 and 64,494 into 2. A 90-year-old patient has lumbar stenosis with radiculopathy and foot drop. A left-sided L3 to L4 and L4 to L5 hemilaminectomy and partial foraminotomy to relieve pressure on the nerve was performed. What CPT codes should be reported? Option A with code 60,042, 63,044. Option B with code 60,017. Option C with code 60,047, 63,048. Option D with code 60,030, 63,035. In this scenario, a left-sided L3 to L4 and L4 to L5 hemilaminectomy was performed with partial foraminotomy. Since the procedure involved hemilaminectomy, also known as laminotomy, we can easily eliminate option B and C as both options include codes for laminectomy procedures. Option A is also incorrect because code 62042 is used for laminotomy procedure performed for vein or re-exploration. This procedure is used in a patient who previously underwent surgery and later developed recurrent symptoms. However, in this scenario, no such history is mentioned. Therefore, the correct option is option D with code 60030 and add-on code 60035 used for laminotomy procedure performed on two lumbar interspaces. An 80-year-old patient with history of low lumbar pain and radiculopathy will undergo bilateral laminectomy with nerve decompression at the L5, L6, and S1 vertebra. Posterior fusion and instrumentation will be performed to stabilize the defect. What CPT codes are reported? Option A with code 60,005 along with modifier 50, 60,011 along with modifier 50, 22,586 along with modifier 51. Option B with code 60,047, 64,048 into 2, 22,842. Option C with code 60,011 along with modifier 50, 63,017 along with modifier 50 along with modifier 59, 22,586 along with modifier 50 and 59, 22,842. Option D with code 63,047 along with modifier 50, 64,048 into 2 along with modifier 50 and 59, 22,586 along with modifier 59, 22,842, 20,936. In this scenario, bilateral laminectomy with nerve decompression is performed at the L5, L6, and S1 vertebral segment. As in this scenario, laminectomy is performed without facetectomy. We first eliminate option B and D with code 60,047 used for laminectomy when performed in conjunction with facetectomy. ASA scenario involved two lumbar and one sacral segment. The correct option is option A with code 60,005, which is used for laminotomy without vasectomy for two lumbar vertebral segments. CPT code 60,011 applied to one sacral segment. Modify 50 with both code is used to indicate bilateral laminectomies. Additionally, code 20,586 is used for posterior fusion and instrumentation. Since arthrodesis is performed in addition to the definitive procedure, Modify 51 is used. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.